Respiratory illnesses continue to surge, and health officials are back to urging residents living in areas with high community levels to mask up when indoors. Here in Michigan, there are growing concerns about a holiday COVID wave. The CDC says nearly 30,000 people in the hospital across the country are positive for COVID, and more than 80% of U.S. hospital beds are in use. Our chief health editor, Dr. Partha Nandi, joined us now. And Doc, many Americans are tired of indoor masking. So is it truly a way to slow this tridemic spread?
Absolutely, people are tired, but masks are very effective, Brian, especially high-quality ones like surgical masks or respiratory masks. They can really lower your odds of getting infected with any of the respiratory viruses that are spreading through our communities right now and creating havoc, including influenza, RSV, and COVID. And that's why the CDC is once again urging Americans to wear face coverings. Now, the agency's map that tracks COVID-19 community levels show that more areas with high infection levels. In fact, almost every state, Brian, has at least one high-risk area. Here in Michigan, it's Schoolcraft County, which is up north. For most of southeastern Michigan, including Monroe, Washtenaw, Livingston, Oakland, Wayne, and Macomb County, the COVID-19 community level is medium. And with the holiday season upon us and family and friends gathering, I'm highly concerned that numbers for respiratory illnesses will spike, including here in Michigan. And that could really strain our hospitals and healthcare systems and trigger drug shortages and bed shortages.
When we were looking at that flu map across the country, we were yellow, one of the few, so that's maybe a little bit of good news. But we know that one of the biggest concerns are seniors, right? And there's some hospitalization rates going up in that demographic, correct?
Exactly, and it looks like it could be a rough winter for our seniors indeed. Hospitalization admissions are rising across the nation, Brian, because of the tridemic viruses. In particular, we're seeing numbers rise for COVID, which we didn't want to see. In just 2 weeks, the rates of seniors hospitalized rose by more than 30% and over 50% and in ages 70 and older. And unfortunately, deaths are also rising. Our national daily average is 466, many of whom are older adults. And it's not only COVID, right? The people are also dying of the flu. There have been over 7,300 deaths from the flu so far and over 120,000 hospitalizations, according to estimates from the CDC. So it's unfortunate that the respiratory virus activity remains elevated across the U.S. So far, millions of Americans have already been ill with one of these viruses. We have to think that it's not just about the individual that's sick, it's the spread that happens when an infected person is outside their home, right? Whether it's shopping, working, or attending holiday parties, but we can all work together to lower transmission rates, and we can do that by wearing masks in public places, staying home when sick, and getting vaccinated against both the COVID and influenza. The vaccination, to me, is a critical part. Lots of people will push back on the masking, but it is effective, and I think it does work.
And so many of us are going to be around either young children or the elderly in the next couple of weeks. So
yeah, it's not all about us, it's about the community.
Yeah. All right. Dr. Nandi, as always.
My pleasure.
Thank you. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter. Glenda?
All right, Brian. Thanks, Doc.